Hello everyone, it's Schematic Med, and today we're going to talk about when to give and not to give thrombolytics. When we're facing the equation, can I give thrombolytics, we need to know this inclusion and exclusion criteria. Inclusion criteria are when we have an ischemic stroke that is coming with a disabling neurological deficit and the symptom onset is less than 3 hours to 4.5 hours before treatment initiation. Strict exclusion criteria are intracranial hemorrhage on CT scan or a history of intracranial hemorrhage, when we suspect subarachnoid hemorrhage. Important point is to assess the history if the patient has a history of ischemic stroke in the past 3 months. When blood pressure is higher than 185 over 110 mm of mercury. When the patient has a neoplasm which is intraaxial. Recent intracranial or intraspinal surgery. Glucose is less than 60 mg per deciliter. Platelets are lower than 100,000 per cubic millimeters. The patient is using anticoagulation therapy at the moment. We also need to do laboratory analysis to check INR, PT, and APTT. When the patient is using anticoagulation, the strict criteria are when the INR is higher than 1.7, when the PT is higher than 15 seconds, and when the APTT is elevated. And lastly, there are some criteria that we need to consider carefully before giving thrombolytics. For example, recent major surgery, recent myocardial infarction, or gastrointestinal or genitourinary bleeding. Thank you, bye.